Hi and welcome. My name is Dr. Devashish Sharma and I am a practicing spine surgeon working in India. So today, friends, we have a very interesting topic. It's called L4-L5 disc bulge or disc herniation. It is by far one of the most common queries or the question asked about spine over the digital media and also in the physical patients. So now, before we start understanding what is L4-L5 disc bulge and how do we treat that, we need to first know what is L4-L5 disc bulge. So I'm trying to do a quick recap of the basic structure of the spine. Our spine comprises of primarily three different kind of bones. Our cervical spine is the neck spine, which has cervical bones. Our thoracic spine or our chest spine comprises of thorax and have thoracic bones or dorsal bones. And last but not the least, our lumbar spine is the one which is the waist spine, and these vertebrae are generally 5 in number: L1, L2, L3, L4, L5. Though there are few variations to it, some of the individuals may have 6 vertebrae and some may have functional 4 vertebrae only. But considering a typical case, we expect 5 lumbar vertebrae in a patient. So now, and they are labeled just for convenience. There are no actual labeling. The God did not label them actually. So the L4 is the second last vertebra of the spine, going from top to bottom, and L5 is the last vertebra of the spine. So L4, L5, since these are 2 vertebrae, the disc in between them is called the L4, L5 disc. There are no specific numberings for the disc, so there is no naming of the disc. So we simply call it as L4, L5 disc. Like you can say there is a road between house number 4 and house number 5. So which road? H4, H5 road. So that signifies the road itself by using the house numbers. So in a very similar way, L4, L5 disc. So when your L4 and L5 disc herniates, there is a small posterior protrusion of the disc material into your spinal canal, which sometimes leads to pressure on the nerves. And if that herniation happens, patient presents to us in the OPD as leg pain. Now sometimes it is as simple as minimal numbness, tingling, irritation, or sometimes as bad as extreme pain, and in a very rare case a bladder bowel involvement and a foot drop, or you can call it as a power degradation or weakness in the legs. So these are the different kind of symptoms patient may present to us. So now, if you have anything like that, if you have any symptoms which are radiating down to your buttocks, the back of your thigh, the calf areas or the heel, or anywhere anteriorly or the front side of the legs, there is a high possibility that you may have L4-L5 disc bulge. And the good news is most of the times it can be very easily treated with conservative management strategies. There is no need of any kind of surgery or any kind of nerve root injections. However, in very specific group of cases where patient is not able to get better with conservative management strategies or with the help of lifestyle modifications, sometimes we give our patients medications which may include non-steroidal anti-inflammatory drugs and some more conservative medications like pregabalin or gabapentin. So these drugs are usually given. Sometimes a short course of steroid medications is also added to reduce the inflammation. Most of the patients, probably in my practice 80 to 90% of patients get better by these kind of treatments, provided you have presented to us during the first week of starting the problem. However, if the problem has been very long with you and you have been suffering and the pain is there for more than 45 days or maybe 60 or 90 days, there is a high chance that conservative strategies may not work for you. You may have to look for alternative options like spinal nerve root injections, endoscopic spine surgery, or maybe microsurgery or any kind of fixation. But for that, you need to be evaluated by a spine doctor in your vicinity, or your reports need to be evaluated in detail. You should be investigated properly, and your power or your examination should be done in order to evaluate what kind of symptoms you're having, for how long you're suffering, and in that way a spine surgeon diagnoses and treats a patient. In my practice, 80-90% patients get better by medical therapy, sometimes injections, and in rare cases we may have to offer our patients an endoscopic spine surgery or a microscopic spine surgery, and these surgeries offer beautiful outcomes with beautiful results. However, this is one important point which I should mention, is that if you are having bladder bowel symptoms or if you are having weakness in the leg, you should not wait and urgently consult a doctor, because those symptoms are difficult to recover in the first place. So don't worry if you're having any L4-L5 disc bulge. The treatment is there. You can get better soon, and I wish for your super speedy recovery. Friends, this channel is for people who are suffering with these kind of problems, or your loved ones who, if they are suffering from these kind of problems. If you have any queries, you can always send us a message or an email over the lower mentioned addresses. We will be happy to respond as the time permits. Thank you very much. Have a great day.